Guys, we're going to check her blood pressure. Put this on the wrist. Okay. And I'm going to check her temperature. Okay, so temperature is 97.3 degrees Fahrenheit. Then I'm going to check her pulse oximetry, check her oxygen level. And while I'm taking the assessments, I'm going to just inspect Miriam's head, make sure it's symmetrical, and I'll inspect the eyes and the ears and look at the symmetry. Everything looks intact and good. And then looking at the blood pressure, 115/80. And the heart rate is 72. And the oxygen is 92. I'm going to now palpate Miriam's head to make sure, feel the bone, and I'm going to check for make sure there's no lesions or lumps. And I'm going to feel the texture of the hair, make sure there's no alopecia, and look and inspect the sides of the head, make sure there's symmetry. And now I'm going to do the cranial nerve system. I'm going to ask Miriam to clench her teeth, and I'm going to ask her to smile, and then I'm going to ask her to puff up her cheek, and ask her to stick out her tongue and move it from side to side, and also to tighten her eyes, close her eyes tight. Okay, so now I'm going to test for the sensation, the light sensation, and just close your eyes and tell me where you feel that.
Forehead, cheek, chin.
Okay. So next, I will move on to the eyes. I'll inspect the eyes, look at the eyes, and I'll get my pen light and look at the eyes. I'll look at the conjunctiva and the sclera, make sure there's no yellowness and there's no erythema or bulging of the eyes. Let's look at the other side. Okay, and just inspect the eyes and palpate. And I'm going to palpate the mandibula, make sure there's no joint clicking. I'm going to ask Miriam to open her mouth. Okay, and close the mouth. Okay. So now I'm going to inspect the ears and look at the ears. Inspect, make sure there's no discharge or any swelling noted. I'm going to palpate the ears. And I'm going to palpate the sinuses, palpate the frontal, make sure there's no tenderness, and the maxillary. Okay, so I'll look in the nose and make sure there's no any erythema or swelling of the nose. The pen light. Okay, so the next thing we'll look at now is the mouth. Make sure it's moist and no lesion. Look at the gums and the teeth. Okay. And I'll ask Miriam to say ah. And I'll check the gag reflex with the tongue blade. And I'm going to check the teeth and the gum. Make sure it all looks intact. No swelling or redness and gingivitis or anything like that. So the next thing is just to inspect the neck, look at the symmetry of the neck and all, and then I will palpate the neck. I'll palpate the trachea, make sure it's central and there's no enlargement or nodes. I'll ask Miriam to swallow to feel the thyroid, make sure there's no enlargement in the thyroid. Now we just palpate. I'll palpate the lymph nodes, the clavicle, the posterior clavicle, the ocular, and the pre- and postal oxala. Now palpate the tonsil. Okay, make sure there's no lymph nodes and all. And I'm going to listen to the carotid on both sides. So listen on one side. And the symmetry on the other side, which is symmetrical. And the pulse is regular. Okay. So now I'm going to look at the posture of the back. Look at the chest. I'm going to look at the chest wall first and palpate the chest. Inspect and do an inspection to make sure that it's symmetrical. And I'm just going to palpate the aorta and feel for the pulses, the apical pulse. I'm going to auscultate and listen. The aortic, the tricuspid, mitral. Okay, and I'm going to check the lateral. Okay, and I'm going to listen to breath sounds. Listen to the sounds lateral, breath sounds. Okay, now I'm going to check the back and look for symmetry and palpate. Okay. Make sure there's no lesions. Make sure the skin is intact. And then I'm going to do the tactile for more. I'm going to ask Miriam to say 99 while I palpate.
99, 99, 99, 99.
Okay. And while I'm in the back, I'm going to check the kidney. I'm going to percuss. Okay. And I'm going to percuss. Okay. And I'm going to auscultate and listen to the breath sounds. Make sure they're clear, non-labored. No rhonchi or rales or wheezing noted. Okay, I'm going to check for the diaphragmatic expression. I'm going to ask Miriam to bend with her arms crossed a little and forward. And I'm going to percuss. And then feel for the change of sound points. And then start from the bottom. Up. And same on the other side. Okay. And now we're going to move on to the heart. I've listened to the heart sounds, but we're going to move on into the laying position so I can listen to the sounds, the heart sounds in the laying position. So we're going to move this. And Miriam is going to lay on the bed and do the assessment in the laying position. Okay. And I'm going to listen to the sounds. In the laying position, listen to the heart, the mitral, the apical. Using the bell, I'm going to listen for any brewery, any changes in the aortic. Okay, so next thing I'm going to inspect the abdomen to make sure the movement is normal. And I'm going to listen to the bowel sounds. I'm going to do the upper right quad, the lower right quadrant, lower right quadrant. Make sure there's no hypoactivity or hyperactivity, and the muscles are active. Okay, then I'm going to do some light. I'm going to do a percussion, feeling for resonance or dullness. And then I'm going to do some light percussion, feel for any nodules or lumps. Then I'm going to do some deep percussion. I'm going to ask Miriam to take a deep breath in. Feel the liver, the location of the liver. Make sure there's no enlargement. I'm going to ask her to take a deep breath and feel for any enlargement of the spleen. Then I'm going to feel for the pulses, the iliac pulse and the femoral pulse. And while she's lying, I'm going to feel for the popliteal pulse. Okay. And then I'll have Miriam sit up, be in the sitting position, and then I'm going to check the muscular strength. So I'll have Miriam put her arms forward. I'm going to check, inspect her hands, make sure there's no curving in the fingernails, and check for any lesions, make sure the skin is intact. Then I'm going to push on Miriam's hand, and she's going to do resistance testing. Okay, and then I'm going to ask Miriam to move her arms out. And I'm going to do the resistance testing. Okay. And now I'm going to check the knee, the legs for resistance. I'm going to push on her knee as she tries to raise it up. Okay. On the other side. And then I'm going to inspect her legs, make sure there's no edema, no swelling, the skin is intact, the hair distribution is even. And I'm going to feel for I'll raise her leg up, and I'm going to feel for the tibial pulse and the pedal pulses. Make sure the rhythm is regular and strong. The pedal pulse and the tibial pulses. Okay. And now I'm going to check reflexes. Okay. I push the knee. Okay. And check the reflexes in the arms. Okay. Alright, so that was our assessment for the Maryville University Head to Toe, and thank you for sharing it with us. Hello, my name is Tomba. I'm a student nurse practitioner at Maryville University. This is Miriam. She'll be assisting me in doing the Head to Toe assessment. I've asked Miriam to empty her bladder and to put on something more comfortable for the assessment. We have done the height, which is 65 inches, and we checked the weight, which was 137 pounds. And now I'm going to take Miriam's bladder size. We're going to check her blood pressure. Put this on the wrist.